Let's talk about the Potter sequence. What is Potter sequence? Potter sequence is when you have bilateral, remember bilateral, renal anomaly, right? You have bilateral renal anomaly, which leads to oligohydramnios by oligouria. So because you have this renal anomalies, there's oliguria or auria that leads to oligohydramnios. When you have oligohydramnios, that leads to compression of the developing fetus, which causes limb deformities, facial abnormalities like low set ears and retrognathia, flattened nose. Looking at the picture, you have the flattened nose and compression of the chest, lack of amniotic fluid aspiration into the fetal lungs, right? Leading to pulmonary hypoplasia, which is the cause of death. So, why do we need that? So remember, the fetus, it swallows amniotic fluid and then urinates that out, and then again swallows that, and then again urinates that out. And through all of this process, we are maturing the lungs. But since we don't have any, we have a low amount of amniotic fluid here. So what's going to happen is we have nothing to swallow, or the swallowing center is down, let's say. That's another cause of it. But here, let's say we have low amniotic fluid. That leads to we can't swallow amniotic fluid, leads to pulmonary hypoplasia, which is the cause of death. Okay. Now let's read the second paragraph. It is caused by chronic placental insufficiency or reduced renal output, including ARPKD, autosomal recessive polycystic kidney disease, or obstructive uropathy, example, posterior urethral valves, or bilateral renal agenesis. This is what I talked about, right? So babies who can't pee in utero develop Potter sequence. Very nice mnemonic. So when you can't pee for any cause, for all of these causes, when you can't pee, you are going to develop the Potter sequence, in which you will have pulmonary hypoplasia, or for oligohydramnios, which is the trigger, or which does all the work. And the child, or not the child, but the fetus is just sequestered, like it's this is the fetus. So the normal, you have the amniotic fluid, and it's nice. The fetus is laying around nicely. But when you have a low amniotic fluid, this is pushing on the fetus, so causing facial abnormalities, extremity defects, or limb abnormalities, just because it has it is pushing the fetus. Okay, and renal failure. So that's what we have for the Potter sequence. And now, important point is, what if, so we did talk about all the causes, but if the mother who's pregnant, right, like pregnant woman, if she takes ACE inhibitors and ARBs, this leads to Potter sequence too. So that's why for pregnant women, ACE inhibitors and ARBs leads to the Potter sequence. And for the retrognathia, what is this? Retrognathia is when the lower jaw, if you look at the lower jaw, is further back than the upper jaw. So upper jaw is, let's say, here, and it should have been at the same point, But now what you have is you have the upper jaw, let's say, and you have the lower jaw. Okay, so lower jaw is further back. That's what the retrognathia is. In extremity defects, you're gonna have club feet. Okay, or limb deformities, as but specifically club feet. And this pulmonary hyperplasia is due to the lack of alveolar distension by aspiration. So you have a lack of alveolar distension by alveolar distension by aspiration of amniotic fluid. So because you cannot aspirate the amniotic fluid, you have the lack of alveolar distension. When you have a lack of alveolar distension, pulmonary hyperplasia occurs. So let's erase that, and that's all we have for the Potter sequence.